Hello, my name's Paul Haslam. I'm a consultant orthopaedic surgeon specialising in knee surgery. I suppose it's difficult to know when you're a young A-level student, how do you decide what you want to be? All I can say is that I was good at sciences and I decided to go with medicine, and I'm very pleased that I did. Doing something where you can genuinely help people is an absolute privilege, and I think, what else would I have done? I think I'm very fortunate in my career that I've chosen something that I enjoy on a daily basis. I then developed my interest in knee surgery, and I wouldn't really want to change anything. I get asked this quite a lot, actually, and so why did I choose the knee over other joints, or why did I choose orthopedics? Well, orthopedics is quite binary. So, for example, if you break a bone, you look at an X-ray and it's broken, and there's often not very much diagnostic challenge. Other aspects of medicine, you may have to do lots of tests and investigations to decide what's wrong with the patient. So, like that instant gratification of knowing immediately what's wrong with the patient, it's not always like that. Majority of occasions that it is. In orthopedics also, you can treat the patient from cradle to grave. So we treat a lot of children with, for example, congenital problems like clubfoot or hip dysplasia, all the way to the end of their life when they have hip fractures in the very elderly patients. So orthopedics provides a vast array of different subspecialties. So how then do you decide on a subspecialty? Well, again, it's just what interests you. And I've always thought the knee was a very interesting joint. Obviously, everyone's heard of knee injuries in footballers, so they can relate to that. And everyone you meet on a day-to-day basis has had contact with an orthopedic surgeon. Virtually everyone's broken a bone, and they can understand what you do. So I think that's why I chose knee surgery and orthopedics. So the most rewarding thing about my job is that most people get better. The World Health Organization have analysed what the most successful treatments are, and two of the top three are knee replacement and hip replacement, the other being cataracts. So the vast majority of our patients get better because of your intervention. So you can take somebody from who's very disabled, not able to walk, not able to do what they want to do, to being able to do it. And that's a really nice feeling. Happy patients make happy surgeons. And again, I feel fortunate that I'm doing a specialty that I enjoy. Certainly things like keyhole surgery, ACL reconstructions in footballers. When the patient is at the end of their rehab and they're back playing football again, or rugby, and you watch them play, it's a good feeling.